Welcome to the deep dive. Today we're diving into a case that, really kind of pushes the boundaries of veterinary neurology.
Absolutely.
So imagine this. You have an 11-year-old Belgian Shepherd.
Okay.
And this is a breed known for their energy and strength, right?
Yes.
Coming into the clinic with a history of progressive lameness in the right front leg. And this has been going on for a year.
It's intriguing, isn't it? And what makes this case even more complex is that the initial diagnostics, the radiographs of the right elbow, carpus, and shoulder, those were all unremarkable.
So if the x-rays are clean,
Right.
where do you even begin to look? What were the next steps in figuring out what was going on?
Well, the physical and neurological exam, those provided some clues. The exam revealed significant lameness, an 8 out of 10, in the right thoracic limb. There was also marked atrophy of the right triceps muscle and slightly reduced right thoracic limb withdrawal reflexes.
Okay.
So these findings pointed towards a possible issue with the brachial plexus.
So the signs were pointing towards a neurological issue, but they needed more information to pinpoint the exact problem.
Right.
What happened next?
To get a clearer picture, they turned to advanced imaging. Specifically, CT scans of the thoracic limbs, cervical spine, and the brachial plexus. And that's where things got really interesting. The CT scan revealed a soft tissue mass.
Okay.
It was nestled in the right axillary region, and this mass was compressing the brachial plexus.
So they finally had visual confirmation of a mass, but did they know at that point what it was?
Not quite.
Okay.
They performed a cytology, which is a microscopic examination of cells collected from the mass. And the cytology results suggested a sarcoma, which is a type of malignant tumor. But to further complicate matters, the thoracic CT also revealed the presence of 2 pulmonary nodules.
2 pulmonary nodules?
Yeah.
That can't be good.
Exactly. The presence of these nodules raised concerns about the possibility of metastatic disease, meaning the cancer might have already spread to the lungs.
So at this stage, we have a dog with a confirmed mass causing significant lameness.
Yes.
And the possibility that the cancer has spread.
Yeah.
What options did the veterinary team have at this point?
Faced with this challenging scenario, the team decided to proceed with a Forequarter amputation.
Wow.
A procedure where the entire front leg and shoulder blade are removed.
Okay.
They also performed a hemilaminectomy from the 5th cervical to the 1st thoracic vertebrae with nerve root transection. So this involves removing part of the bony arch of the vertebrae to access and sever the affected nerve roots.
Wow, that's a major surgery.
It is.
But did they know for certain at this point that they were dealing with a sarcoma?
It was strongly suspected.
Okay.
But the definitive diagnosis came after the surgery when they examined the removed tissues under a microscope, and this is called histopathology.
Right.
And it confirmed their suspicions. It was an extraskeletal osteosarcoma.
EOS.
Or EOS.
Okay, so this isn't your typical bone cancer.
You are absolutely right. EOS is a type of cancer that originates in the soft tissues, not the bones. And finding it in the brachial plexus is exceptionally rare. This is actually the first documented case of canine brachial plexus EOS.
So they removed the entire leg and shoulder blade, severed the affected nerve roots, and confirmed that it's this very rare type of cancer.
Yeah.
What happened next? Did the dog recover from such an extensive procedure?
The dog did experience some neurological deficits immediately following the surgery, which is to be expected after such a major procedure. However, with supportive care and physiotherapy, the recovery was nothing short of remarkable.
That's pretty amazing to go from a year of progressive lameness and a major surgery to recovery.
Right.
What kind of timeline are we looking at here?
What?
How long did it take for the dog to return to kind of a normal life?
Within 3 months, the dog was back to its normal activities, running and playing off-leash.
Wow.
And here's the kicker. A year later, a follow-up CT scan showed no signs of the tumor recurring.
Wow.
Or spreading.
That's an incredible outcome.
It is.
But does this change how we think about treating these tumors? Is this a one-off, or could other dogs benefit from the same approach?
That's the burning question, isn't it? This case really challenges our understanding of EOS. Because it's so rare, the research is limited, and there are so many variations in how it presents depending on where in the body it develops.
So how do you even begin to make treatment decisions when you're dealing with such a rare and unpredictable disease?
It's definitely a challenge. Some studies suggest that visceral EOS, the kind that originates in the internal organs, might have a worse prognosis than non-visceral EOS. However, these terms aren't always clearly defined, and the studies often have small sample sizes, making it tough to draw definitive conclusions.
So this case, with its successful outcome despite involving the brachial plexus, a complex and critical anatomical area
Right.
as a valuable piece to the puzzle.
It really does. This dog's survival for over a year after surgery, even with incomplete margins, really challenges the conventional understanding of EOS prognosis.
It sounds like there's a lot we still don't know about EOS. What are some of the key areas where more research is needed?
One of the biggest questions is the role of chemotherapy in managing EOS. There's a lot of debate about its effectiveness.
So in this case, the dog didn't receive chemotherapy and it still did incredibly well. Does that mean chemotherapy isn't necessary for EOS?
It's not that simple. There have been a couple of retrospective studies looking at chemotherapy after surgery for EOS, but they were limited by small sample sizes and variations in things like tumor location, the extent of surgical removal, and the chemotherapy protocols used.
So it's hard to say for sure whether chemotherapy truly makes a difference in survival times.
Exactly. One study did show that dogs receiving chemotherapy had a longer median survival time, but the difference wasn't statistically significant. We need larger prospective studies to really understand the benefits and risks of chemotherapy for EOS.
This case also highlights the importance of advanced imaging, like the CT scans used here, in diagnosing brachial plexus tumors.
Absolutely. Those scans were crucial in this case. They helped pinpoint the tumor's location and extent and rule out other potential causes for the dog's symptoms.
It's interesting that the initial cytology suggested a sarcoma, which the histopathology later confirmed, but I understand that those two don't always match up.
That's a crucial point. When it comes to brachial plexus masses, there can be discrepancies between what we see under the microscope with cytology and the definitive diagnosis we get from histopathology.
So even though cytology provides valuable information, it's essential to follow up with a biopsy and histopathology for a conclusive diagnosis.
Precisely. That definitive diagnosis guides our treatment decisions and helps us give owners a realistic prognosis.
In this case, the histopathology revealed EOS, which was a surprising finding, especially since imaging didn't show any mineralization within the tumor.
Right. We often associate mineralization with EOS, but research in humans shows that it's only present in about a quarter of cases.
So the absence of mineralization on imaging doesn't rule out EOS. This case really demonstrates the complexity and challenges involved in diagnosing these conditions.
It certainly does. It emphasizes the need for a thorough and systematic approach to diagnosis and treatment.
Despite the odds, this case shows that a positive outcome is possible, even when facing a rare and aggressive disease.
It's a powerful reminder of the importance of careful diagnosis, skilled surgery, and attentive post-operative care. And of course, the incredible bond between humans and their animal companions and the lengths we'll go to for their well-being.
This deep dive has given us a lot to think about. This case opens up a whole new avenue of inquiry. What are some of the next steps in understanding EOS, especially in the nervous system?
We need to learn more about EOS behavior in different locations. And of course, we need to improve our diagnostic tools to identify it earlier and more accurately.
It also seems like collaboration between different veterinary specialists, like the neurology, surgery, and oncology teams in this case,
Right.
is key.
Absolutely. The successful outcome here was a direct result of seamless teamwork between these different disciplines. This case beautifully illustrates how collaboration can benefit our patients.
What stands out to you most from this case?
For me, it's the dog's resilience. Facing such a challenging diagnosis and undergoing such a major surgery and still returning to a normal, active life. It speaks volumes about the strength of the human-animal bond and the power of hope.
I agree. So as we wrap up, the crux of the matter remains. How does this case, with its successful outcome, change our understanding of extraskeletal osteosarcomas and their potential treatment in veterinary medicine? That's the burning question. This deep dive has really opened my eyes to the complexities of EOS and just how much we still don't know.
It certainly underscores the need for continued research, particularly when it comes to the nervous system. We've touched upon the debate surrounding chemotherapy, but there are other aspects that warrant further investigation, like what factors influence the development of EOS in the brachial plexus? Are there any genetic predispositions?
And how can we improve early detection? If we can catch these tumors sooner, can we potentially explore less invasive treatment options?
These are excellent points. Earlier diagnosis could potentially open the door to limb-sparing surgeries or even targeted therapies that could avoid the need for amputation altogether.
That would be a game changer for both the dogs and their families. It's incredible to think that this one case, this one dog, could potentially pave the way for new discoveries and treatment approaches that could benefit countless other animals.
It speaks volumes about the power of careful observation, thorough investigation, and a willingness to challenge conventional thinking in veterinary medicine.
This case also reminds us that every animal is an individual, and what works for one may not work for another. It highlights the importance of personalized medicine, tailoring treatment plans to the specific needs of each patient.
Absolutely. In this case, the owner opted against chemotherapy, and the dog had a remarkable recovery. But that doesn't mean chemotherapy isn't a valuable tool in other EOS cases. It's all about weighing the potential benefits and risks in the context of the individual patient.
It's a constant learning process, isn't it? We're always striving to improve our understanding of these complex diseases and refine our treatment approaches.
Indeed. And cases like this one where the outcome defies expectations serve as a powerful reminder that there's always more to learn and discover.
This has been an incredibly insightful deep dive. I feel like we've only just trashed the surface of this fascinating topic.
There's certainly much more to explore, but I hope this discussion has provided some valuable insights into the complexities of EOS and the importance of ongoing research and collaboration in veterinary neurology.
It definitely has. So for all our listeners out there, keep those minds inspired, hearts light, and tails wagging. From Vet Neuro Jar Yar.